Hello everyone, you are all welcome to lecture number 1125, and today's lecture is on stimulant drugs, its a risk and uh, the health problem, that is side effects. And as you know, nowadays I am discussing especially the narcotic drugs, and I've already discussed a lot of different type of drugs, how they are going to impact to your brain, that is central nervous system, and your dopamine chemical, that is neurochemical release, and of course lot of mental issues dealing depression, anxiety, having more happiness, euphoria, all these are associated with all these narcotic drugs. And here, this group of drugs, I have already discussed one lecture. Now today I am going to discuss these three drugs which are powerful stimulant drugs. One is called cocaine, second one is nicotine, and third one is caffeine. So first I will be taking the cocaine. As all of us know nowadays that cocaine is one of the most powerful drug as a central nervous stimulant, and this cocaine is illegal or prohibited, or even in some countries like Singapore and Middle East, if you are having 20 to 50 gram of cocaine, sometimes there is capital punishment or even life imprisonment. The reason is that this addiction of cocaine is very dangerous for the youth, because once they are addicted, there is a lot of economic loss as well as human loss, and it is very difficult to recover from the addiction once they are addicted. This cocaine is a plant product, it is alkaloid, and it is isolated from coca leaves, and most of these plants they grow in South America, Colombia, Brazil, and then South Asia countries, in Afghanistan and Indonesia, also in India and Pakistan. And this cocaine is extracted in the form of salt, that is called cocaine hydrochloride salt. And second one, that which is processed again, which is treated with that is ammonium carbonate and ammonia, and we get the crystalline, white crystalline or slightly yellowish color crystal, and that is called crack. Crack means once it is processed and when the crystal formation is there, it is giving cracking sound. That's why on a street they call it crack. And the crack is widely used to inhale by nose and oral in the form of smoke. And this cocaine hydrochloride is mainly given intravenous in the form of injection, and this one is very common among youth, that is crack, because once crack is smoked or inhaled by nose, it directly goes to lung, and from the lung within 1 minute time it will enter to your bloodstream, and you will notice the effect. The first effect of this cocaine drug is you will feel hallucination, euphoria. If I say hallucination, means it is false thinking and false impression about ourselves. For example, hallucinating means I am nothing, but after taking the cocaine in the form of crack or cocaine hydrochloride, will feel that we are VIP, we are Shehu of Borno, we are Emir of Kano, we are so big, so powerful, so energetic, nobody can challenge. So such type of euphoria, feeling and happiness is associated with this cocaine stimulant drug, and it stimulates your brain cells, and even it disturbs the neurochemicals. For example, once you are taking cocaine, this is a type of alkaloid, it will make your neurochemical, especially the dopamine or serotonin, to release in excess. And that release in excess, the dopamine or serotonin, means immediately you will feel more happy, excited, anxiety built up. It is because of excess release of your neurochemicals. So that's why this cocaine is having a lot of impact on your state of mind, on your central nervous system, and of course it lasts for 90 minutes, that is 1.5 hours. And the danger to this drug is that once the impact of this drug is slowly reduced, again you will desire to have the same euphoria and happiness, false impression, that is hallucination. So that's why you will need more and more, and that way you will be trapped in the cage of that is called addiction. And once you are addicted, you are going to lose a lot. You will be losing first your health, your mental level, your anxiety, depression, your money, and in the society you will be losing your status. You will be having different outlook, always feeling tired and looking for something, isolating from the societies. All these factors will demoralize you. So that's why this cocaine is rated as one of the most dangerous stimulant. The second one, that is called nicotine. Nicotine is tobacco alkaloid, or we call it also cigarette alkaloid. And this tobacco, it contains nitrogenous compound, that is alkaloid. It's known as nicotine. And this nicotine is a stimulant, and also it is harmful to your health once it is taken in the form of cigarette smoking. Actually, the cigarette smoking, it has its own history. How people got addicted to cigarette, that is tobacco alkaloid, that is stimulant, nicotine is acting. In Britain, some few hundred years ago, when some criminals were caught and they were put behind the jail, and the punishment was given that they have to smoke 10 or 20 cigarettes within 4 hours or 5 hours time. So they were forced to smoke tobacco. And once they were forced to smoke the tobacco, after some time, they developed the addiction. And that's why the addiction started with this nicotine, tobacco smoking in the form of cigarette and in the form of chewing of in India, there is chewing of the tobacco. It's very common. Orally they are taking. And cigarette is, or cigar is in the form of smoke, inhaling, orally as well as nasal. So this nicotine, once it is taken for some time, you will be addicted. You will desire to have cigarette time to time. And the third one is, that is called caffeine. Caffeine is isolated from coca leaves And also it is found in many plants like coffee plant or tea plant and some other plant. Some percentage of caffeine is there. Caffeine is also one of the stimulant drug. And once you are taking coffee which contains caffeine, or tea also contains caffeine, your laziness, your dullness or drowsiness will be removed and you will feel energetic. But if you are taking in excess amount, it may cause blood pressure, and also it may cause some cardiovascular problem. And in the case of tobacco, this nicotine as well as cocaine, the first very serious problem is that is there is always chance of getting cancer, also your cardiovascular disease, heart attack, heart failure, respiratory problem. All the health conditions are associated with all these stimulant drugs, and at any cost these drugs should not be available easily to young children, because most of these drug users which are abusing this drug, or those who are addicted, mostly they are youth, and sometimes some rich people are also are the victim of this addiction of especially the cocaine and heroin. So this is about the stimulant drugs. So I am going to give one by one. So here number one, cocaine, that is stimulant drug. It was reported in the year 1884 and 1887 by Sigmud Freud, and he found that the substance is having limitless potential source of exhilaration and lasting euphoria. And this cocaine, that is coca leaf, it was very common even 400-500 years ago in Southern America. The local people, when they feel tired and when they were hungry, they will go and take few pieces of coca leaves, and after taking that coca leaves they were feeling energetic and relaxed. So that was the practice in Southern America, and that was the effect of cocaine which was present in that leaves. Potential source of exhilaration and lasting euphoria. Euphoria means it is intense temporary happiness for 90 minutes. That is called euphoria, and you will get euphoria after taking this cocaine. That is called hallucinating effect. Number two, the cocaine drug is extracted from the leaves of erythroxylone coca. So erythroxylone coca is the scientific name of the plant, and from that plant leaf, that is called coca leaf, it is extracted in the form of salt, and when it is treated with hydrochloric acid, this salt that is alkaloid, it is basic, and hydrochloric acid is acid. Once they will react, there will be formation of salt, and that salt is extracted and purified. That is called in the form of coca hydrochloride. That is one form of cocaine. The other form of cocaine which is treated with soda, that is sodium bicarbonate and ammonia, and during this process the cracking sound is there and crystal is formed. That's why it is called crack, and that crack is mainly used for sniffing purpose and for a smoking purpose. That is, this plant grows in South America, South Asia and South Africa. Cocaine drug stimulates central nervous system, that is CNS, and it is very powerful stimulant drug that affect our central nervous system. Number three, cocaine is mostly found in the form of salt called cocaine hydrochloride and crack. The crack is solid crystal, comes from cracking sound when it is manufactured with baking soda and ammonia. So number 4 is ordinary cocaine after treating with soda plus ammonia and water. This mixture is heated in a pot and then it is dried, and after drying it will be broken in the small pieces, and that with cracking, that's why it is called crack, with chunks is called crack, and which is sold in the market in the name of crack. Number 5, during cocaine abuse, it is used by injection or by sniffing it. It is quickly absorbed by mucous membrane of the nose. Effect will be only within 15 seconds once it is inhaled by that is nasal inhalation in 15 seconds, and it will be hitting your brain central nervous system, that is CNS, within 15 seconds once it is inhaled by nose, because directly it will go to your nasal mucous membrane and will be immediately absorbed by the blood stream and lung. Cocaine vapor is very sharp in action. Sometimes the cocaine vapor, is taken in the form of vapor. Smoke and vapor, they are always similar. That is in smoke form. It's a very, very sharp action for the vapor. And addiction may cause health risk, that is psychological. That is, psychologically you will be always in depression or bad mood or sometimes irritation, and you will not like to mix with the people. Then mental problem also, you will not be confident of doing anything, and you will be losing your thinking power also, concentration. All these mental problems will be there. You will develop anxiety, and once you develop anxiety, that product is depression and heart problem, and also you may get cancer. So lot of health risk and health problem is there once you are addicted to cocaine. Number 2, that is caffeine, is also a natural product, and it is a natural, I can say, stimulant of our central nervous system. It is natural product found in various plants. It is also a stimulant, and it is commonly found in coffee and tea. Caffeine is alkaloid and belongs to a xanthine class of compound. It acts on central nervous system. It has negative effect of sleeplessness. Means if you take more in excess quantity, you will suffer from insomnia, means sleeplessness. And if it is taken in large quantity, so taking in moderation can stimulate your mood, and you will feel energetic, and it will remove your drowsiness, laziness, all these things. And this is your caffeine structure. It contains nitrogenous nucleus. Actually, all these alkaloids is a must to have nitrogen in the part of the ring, either as pyridine ring or any 5-member, 6-member ring. Nitrogen must be there in that alkaloidal compound. So here there is 2 nitrogen. C8H10, the 4 nitrogen, 1, 2, 3, 4, C8H10 and 4 O2. The next one is, that is nicotine. Nicotine, it is the most important tobacco alkaloid found in the plant Nicotiana, and it usually occurs in the form of salt. The powdered tobacco leaves are extracted with water, and after the extraction, it is treated with suitable alkali. It can be potassium hydroxide or sodium hydroxide, and then that acidic, nicotine will be converted into salt, and it will be precipitated out, and then it is distilled and purified in the form of pure nicotine. So number two, that is nicotine is stimulant and substance of addiction in the form of cigarette smoking or tobacco chewing or cola nut chewing. Actually, in India, the addiction is both smoking, that is cigarette smoking, and also tobacco chewing. But in Nigeria, only two are there, that is either cigarette smoking or cola nut chewing. Cola nut is also, it gives you some stimulating effect because of the presence of alkaloid and that is nicotine. Chewing, it stimulates the central nervous system, leading to increase the heart rate, blood pressure, and release of dopamine. It also, it is, the research shows that once you are taking regular nicotine, means in the form of cigarette smoking or in the form of tobacco chewing, in your brain the release of dopamine will be more, and in that case it will trigger the addiction, because once you will stop and now you are habitual of releasing some more dopamine to stimulate your mood and to make you more relaxed with good mood. So again you would like to smoke after every 1 hour, 2 hour or 3 hour like that. It's because of the brain chemistry. Nicotine is having various health risks like cancer, respiratory disease, heart attack, and high blood pressure. Most of the lung cancers nowadays they are linked to nicotine or tobacco chewing or tobacco smoking. This is the structure of nicotine, where it is having pyridine nucleus, C5H10N, that is side chain is 5-membered. This 5-membered ring is containing nitrogen, and this 6-membered ring is containing, that is aromatic ring, is nitrogen, that's why it is called pyridine. So nicotine contains pyridine nucleus, C10H14N2. So with this I will stop. Thank you very much for watching the lecture.